Welcome to our webinar titled Managing Treatment Symptoms with Diet. Thank you for joining us. My name is Lee Clark, Director of Patient Services, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generosity of our corporate sponsors and the generous support of our patients, families, and caregivers for supporting the program today. It is possible during the program, you may lose your connection. If you're unable to view the program online, you can call in to hear the audio portion using the call-in number in your reminder email. Today's program will be archived to our website within just a few business days. You will be notified by email when it is live and ready for viewing. Immediately following the presentation, there will be a question and answer session. Please feel free to submit your questions at any time during the presentation. To submit a question or comment, open the Q&A window in the lower part of your screen. Type in your question or comment in the small text box window, and when you finish typing, just hit enter. We'll do our best to get to everyone's questions today. When asking questions, I do ask that you do two things to help me manage the incoming questions. First, submit your entire question all at the same time. Second, please do not share private health information in your question. Our expert speaker cannot answer any specific questions related to your personal health care. Our specialist today is Joanna Myers Casale, who is a registered dietitian at the MD Anderson Cancer Center at Cooper in Camden, New Jersey. She is board certified specialist in oncology nutrition. At MD Anderson, Joanna works with hematology and oncology patients to support them during their treatment and reduce side effects. She educates her patients on foods to support their immune system and recovery. With all that said, it's my pleasure to welcome Joanna. Thank you so much for joining us today.
Thanks for having me, Lee. Okay. All right, so let me get started. So today I was hoping to speak about some of the side effects that might happen with our treatment and how we can manage those through nutrition. Okay, so one of the most common symptoms is nausea, which is sometimes accompanied by vomiting. Some of the recommendations I would make if someone is nauseous is to focus on small but frequent meals. Digestion is actually very complicated, and if we give our stomach a lot of food to work on at once, it's more likely to have some difficulty. But if we focus on small amounts, digestion is going to work a little bit more efficiently. When you're nauseous, it's also helpful to focus on bland foods, especially starches and carbohydrates. So some examples of well-tolerated foods include crackers, room temperature fruit, plain noodles, mashed potatoes, oatmeal or cream of wheat, toast, cereal, pretzels, rice dishes, and any broth-based soups. Many patients also find that ginger helps to reduce nausea, and you can consume this as a ginger tea, ginger ale, ginger candies, or using ginger in your cooking. When you're nauseous, sometimes the aroma of food can exacerbate the symptom, so it may be beneficial to choose foods with little or no aroma. Cold foods often have a decreased smell and they may be better tolerated. I would suggest avoiding any foods that are spicy, heavily seasoned, or very acidic, such as tomato and citrus products, or very greasy foods. We often find that these can make nausea worse. I would recommend that you speak with your care team about any nausea medicines. We can help you figure out which ones to take and when. And I would suggest timing your meals based on when the nausea medicines are working the best. Another common symptom is taste changes, which we sometimes call dysgeusia. And patients often tell me foods can taste bitter or metallic or very bland or overly sweet. Some of the suggestions I have are to try a variety of foods, be open to new foods and flavors, increase the use of herbs, spices, seasonings, and marinades. Sometimes these can bring out better flavors of food or they can mask some of the unwanted flavors. Foods can taste very different at different temperatures. So one item can taste one way when it's hot, a different way when it's cold, or even different when it's room temperature. For a metallic taste, you can try plastic or bamboo utensils or even chopsticks. And for metallic taste, we would suggest that you avoid silverware and canned goods. You can pick up on the metal taste in those. We recommend that patients try to cleanse their mouth before meals. It can be a simple mouthwash of baking soda, salt, and water. And some patients actually find benefit by rinsing their mouth with carbonated water, seltzer water, or club soda. The bubbles seem to help foods taste a little closer to normal. In between meals, you can try sipping on mint tea or mint candies. They can help your mouth taste a little bit better in between meals. There is a professional chef named Rebecca Katz, and she has done a lot of work on taste changes during treatment and how we can change our cooking methods to work around those. And the method that she uses is called FAST, which stands for fat, acid, salt, and sweet. And some of the ways that these different flavors can change the food. The fat, for example, helps to distribute flavor across the palate. So you can add more fat to your meals by using olive oil, butter, coconut oil, or sesame oil. Acidic or sour flavors help to draw out and brighten flavors. So this can be achieved with lemons, lime, vinegars, tomatoes, and pickles. Salt helps to bring out the flavor of food. So this can be regular table salt, kosher or sea salt, soy sauce, bouillon, fish sauce, or even using some bacon or ham in your cooking. And sweet helps to tame harsh, bitter, sour, and spicy flavors. So this can be using sugar, maple syrup, honey, agave, fruits, or even caramelized onions. So some examples in how we would use this with our patients is if someone tells me foods have a metallic taste, I would suggest adding a little sweetener like maple syrup, honey, or agave, and squeezing a little bit of lemon. You could also try adding a fat, such as a cream, a butter, or a sour cream. If foods are tasting too sweet, a little bit of lemon or lime juice helps to improve the flavor. If foods are tasting too salty, adding some lemon juice can erase the taste of the salt. If foods are too bitter, adding a little sweetener like the maple syrup, honey, or agave nectar can help. And if everything tastes like cardboard, a little bit more salt helps the flavor of the dish move forward to the front of the mouth. And then a little bit of lemon juice can also help. However, if you are dealing with mouth sores, you may want to avoid adding anything too spicy like pepper flakes or other strong spices, so you can focus on adding fats such as a cream to your food. I wanted to mention a product called Miracle Berry or Miracle Fruit. Miracle Fruit has a type of protein that coats the taste buds and temporarily alters their shape and flavor. So what this often does is it blocks the sour receptors and activates the sweet receptors. So if I have a patient who tells me their foods are all tasting too sour or bitter, then I would have them try this product as it's going to help those flavors taste more sweet. So this is something that can be sold as a fresh fruit, as a freeze-dried fruit, or in tablets. And what the patient would do is take the tablet, for example, and allow it to dissolve in their mouth and coat their tongue, and then they would go to eat. And some examples of how this will change the taste is after having some of the Miracle Berry, if a patient were to drink lemon juice or take a bite of a lemon, it would actually taste like lemonade. Or if they were to have some balsamic vinegar, it would taste like a raspberry syrup. So this is a product that could help some of our patients who are struggling with those particular taste changes during treatment. Now, on the opposite end of the spectrum, there's a product called Jimena sylvester, and this is an herb that is used in traditional Ayurvedic medicine. And this works sort of the opposite as the miracle berry. It can inhibit the sensation of sweets by blocking the sugar receptors on the tongue. So if I have a patient who tells me everything tastes too sweet and it's not palatable, this may be a product that is beneficial to them. This is available in the form of tea or as a gum. So if a patient wanted to try this, they would chew the gum before their meal or brew some of the tea and swirl it around their mouth for 30 seconds. And then they would move forward with their meal and hopefully it won't taste as sweet as it did before. Now, a sore mouth is a common symptom, especially for our patients who undergo a stem cell transplant. And sometimes we refer to this as mucositis. When someone has a sore mouth, we would encourage them to avoid foods that are going to make that pain worse. And that would be anything very hot, both from a temperature standpoint and from a seasoning standpoint. Anything too spicy, too salty, the salt can actually sting a little bit, and anything very acidic like tomato, citrus, or even too much vinegar. We would suggest that they focus on soft, bland foods such as smoothies and soups, mashed potatoes, soft noodles, eggs, cottage cheese, bananas, canned peaches and pears, and yogurt. And anything very dry may be easier to eat if it's moistened with a sauce or a gravy. For example, dipping bread into soup to make it a little bit softer and soggier can help it be more comfortable to eat. Honey can often soothe the mouth and promote healing from that damaged tissue. So you could truly take a tablespoon of honey and swirl it around the mouth and then swallow it, or just add more honey to your teas or beverages. If someone has a sore mouth, we would recommend that they avoid any alcohol-based mouthwashes, which are going to be painful, and instead try a rinse of baking soda and water, or any of the gentle over-the-counter products such as the Biotine mouth rinses or the Natural Dentist mouth rinses, which are alcohol-free. Glutamine is an over-the-counter product that has been shown to protect someone from developing mouth sores, or once they've developed, help them heal a little bit faster. Glutamine is an amino acid that is a great form of nutrition for all of the cells that line the GI tract from the mouth and further down. And glutamine is readily available at vitamin or supplement stores or online. Some of my patients buy a product called Helios, which is glutamine that has been formulated to be more readily absorbed by the GI tract. And Helios can be ordered online at inlivity.com, or it's also available on Amazon. And for anyone who's struggling with chemotherapy-induced neuropathy, a lot of my patients have had some success by taking glutamine for several months, and it helps to reverse that. Dry mouth is another very common side effect during treatment. Some of the recommendations would be to ensure that fluid intake is adequate. If we're dehydrated, our mouth is more likely to feel dry. It can be very challenging to eat when we have a dry mouth. Patients tell me it feels like food is just sort of clumping up in their mouth and it doesn't become softer or break down at all. So it can be helpful to alternate between bites of food and sips of fluid during the meals, just to add some moisture. Foods are going to be easier to eat if they have broth, gravy, or a sauce added, just to make sure that they're more moist. And I would encourage patients to think about more moist cooking methods, such as steaming or braising, using a slow cooker or a pressure cooker. Chewing gum or sucking on hard candy sometimes helps to stimulate saliva production, or snacking on fruit, which has a high water content. Similar to the mouth sores, we would suggest staying away from any mouthwash that contains alcohol, which will be drying. And it can sometimes help to consider a humidifier in the home. Just make sure you speak with your healthcare team. Anyone who's severely neutropenic, their team may discourage a humidifier just because if it's not cared for properly, it could be a source of bacteria or mold. And some patients use artificial saliva products such as biotin or xylamelts, which help the mouth to feel a little bit more wet and slippery versus feeling so dry and uncomfortable. Moving further down in the GI tract, constipation is a very common symptom during treatment. I always encourage patients to make sure they're well hydrated. That's one of the most important things we can do to prevent and treat constipation. Any beverage will help to hydrate a patient, and any food that melts at room temperature will also count as fluid. So I would encourage patients to increase their intake of water, but it can also be seltzers, juices, tea, and coffee. We can also get fluid from broth, water ice, popsicles, jello, and watery fruits such as melon. Sometimes it can be helpful to increase our intake of fiber, which eases constipation by adding bulk to stool. And we can get fiber from our fruits and vegetables, whole grains, and beans. It can be helpful to drink half a cup of warm prune juice, which has a laxative effect. Some patients like to drink smooth move tea, which contains senokot, a stimulant laxative. And snacking on dates, apricots, or prunes can alleviate constipation because of the fiber content and the sorbitol. Any bit of movement can help to stimulate bowel function, even if it's just a short walk or a gentle yoga class. And of course, make sure you speak with your healthcare team about any stool softeners or laxatives. On the other end of the spectrum, for diarrhea, we would encourage patients to avoid or limit any foods that may worsen the symptom, which would often be caffeine, such as coffee, tea, sodas, chocolate, dairy products, particularly milk. So you can replace that with a lactose-free milk, such as Lactaid or Fairlife, or any of the non-dairy milks, almond, soy, oat, coconut. Very hot or very cold foods or drinks can exacerbate diarrhea, so sometimes it can be better to focus on room temperature. And anything very high in fat, fried, greasy, and fatty foods often make the symptom worse. Hold off on any spicy or heavily seasoned foods, and stay away from any sugar alcohols, which are commonly found in sugar-free gum or sugar-free candy. They can often make diarrhea worse. When we have diarrhea, we are at a higher risk of dehydration because we're losing fluid through our stool. So make sure that you're sipping on fluids throughout the day and focus on small, frequent meals. Many of you who've had diarrhea in the past may have been told by your team to focus on the BRAT diet. And the BRAT diet stands for bananas, rice, applesauce, and toast. Oatmeal is another good BRAT food. And these foods help with diarrhea because of the type of fiber they contain, soluble fiber, which helps to soak up water and makes stool a little bit more thicker and formed. When we have diarrhea, we're losing a little bit more electrolytes like sodium and potassium through our stool. So be sure to replace that through broth, soups, sports drinks, crackers, pretzels, potatoes, and bananas. Some patients find that it's helpful to lie down for 30 minutes after a meal. That just slows down digestion. And of course, make sure you're speaking with your healthcare team about any anti-diarrhea medicines. Banana flakes are a product that works really well with diarrhea, and it's generally a very safe product for patients to use. Banana flakes are high in pectin, which is that soluble fiber that again helps to soak up water and make stool a little bit more formed. And banana flakes sometimes also contain prebiotics that are a fuel source for the beneficial bacteria in your GI tract. Banana flakes are easily found online or at certain health food stores, and it's a powder that can be added to a soft food like applesauce or to a glass of water or juice, and it can be taken several times a day, and it works very well for diarrhea. I wanted to mention a great product called Enterade that helps with many of the symptoms we've spoken of already. So Enterade is a medical drink that includes amino acids and electrolytes that help to rebuild and protect the GI tract, especially with any cancer therapy. I have found that Enterade can help with mouth sores, nausea, diarrhea, and as a result, the dehydration that may come from those symptoms. Enterade can be ordered online, and it's also available on Amazon, but your healthcare team may be able to order you some samples to try this product. I wanted to mention a loss of appetite, which could happen because of any of the symptoms that we've discussed, or sometimes this happens even without any belly symptoms. So a poor appetite is often associated with weight loss. And some of the recommendations we make are to eat based on the time of day versus waiting for hunger cues, focusing on small but frequent meals. So sometimes I ask patients to try to eat every 1 to 2 hours that they're awake, even if it's only 2 bites at a time. It helps to keep favorite foods readily available, including non-perishable snacks by the chair and the bedside, especially for a patient who's weak and feels fatigue and may not have a lot of energy to go to the kitchen. Eat your favorite foods at any time of the day. So if breakfast foods are appealing for dinner, that's okay. Or if dinner foods are appealing for breakfast, feel free to eat those. And sometimes it helps to drink most of your fluids in between meals instead of with meals. Sometimes if we're trying to eat and drink at the same time, that leads to us feeling full too early, and we've missed out on eating all of the nutrition that we need. When we have a poor appetite, try to make sure that every bite you take contains a really good amount of calories and nutrients and protein. So some examples of high calorie and high protein snack ideas include mixed nuts or a trail mix, nut butters on fruit, crackers, or bread, hummus with pita or a favorite cracker, guacamole with tortilla chips, Greek yogurt with granola, hard-boiled egg with crackers, cheese and crackers, cottage or ricotta cheese with fruit, or a quick and simple baked potato or sweet potato. And of course, speak with your healthcare team about any appetite medicines. We use those often at my cancer center. When someone has a poor appetite, it's often easier for them to get more of their nutrition through drinks. When we're not very hungry, sometimes it's easier to drink something than to chew a food and chew a food. So we often recommend protein shakes in between meals. Many of you might be familiar with Boost Ensure or Carnation Breakfast Essentials, which are great products. Some of my patients prefer organic ingredients, and that's when I would recommend Orgain or Kate Farms. You can also purchase high protein smoothies. Some common brands are Naked and Bolthouse Farms, or you can make homemade milkshakes or homemade high-calorie smoothies. I wanted to give an example of a high-calorie smoothie that can be made quickly at home. So this is a banana nut smoothie, and the ingredients would be 1 banana, about 2 tablespoons of nut butter, which could be peanut butter, almond butter, or for someone with a nut allergy, they might use sunflower seed butter. If you'd like, you can boost the protein by adding 2 tablespoons of a protein powder, or a little bit of a Greek yogurt will also add protein. and 1 cup of milk, or if preferred, a non-dairy milk. Combine the ingredients in a blender and blend until smooth. And this would be approximately 350 calories and about 26 grams of protein. I wanted to make sure I went over some resources. I would encourage any of you struggling with these nutrition symptoms and side effects to ask about working with a registered dietitian at your treatment center. Very often a dietitian is available, but it may just be on an as-needed basis. So speak with your team about a consult and they may be able to orchestrate that. If you don't have access to a registered dietitian at your care center, you can find one on the Academy of Nutrition and Dietetics website. It is eatright.org. And I would encourage any of you using this to find a dietitian to think about specifying an expert in oncology or hematology. That will ensure that the dietitian is board certified in oncology nutrition, which means that they have 2,000 hours of experience and they've completed a board exam. And for those of you who are within a pediatric population, you can also specify an expert in pediatrics, which also means 2,000 hours of experience and passing a board exam. If that doesn't provide any resources in your area, another option is Pearl Point Nutrition Services. They offer free nutrition education and consultations to patient and caregivers, and their website is pearlpoint.org. Their website also has wonderful resources, including meal plans and recipe ideas, and plenty of tips for side effects and symptoms. And then the last resource I wanted to leave you with is Cook for Your Life, which is cookforyourlife.org. This is run by the Fred Hutch team, including their dietitians, and their website has a variety of recipes. What I love about it is that you can filter based on any side effects you may be experiencing, including nausea, a sore mouth, taste changes, diarrhea, or constipation. You can also filter by preparation methods, which includes budget-friendly, no cook, quick and easy, 3 steps or less, or by any dietary preferences, including kid-friendly, vegan, vegetarian, or gluten-free. And then we have plenty of time for questions. I think I went through that a little too quickly.
Thank you so much, Joanna. We have quite a few questions. Our first question is, what are the best sources of fat?
Sure. So I feel like sometimes there's no wrong answer to that. But if I had a patient who overall is maintaining their weight pretty well and appetite is fair to good, then we could focus on very healthy fats that are also anti-inflammatory. So examples of those fats would be using olive oil or canola oil, or having avocado or guacamole, or it could also be fatty fish such as salmon or tuna, or nuts and nut butters, which have a lot of fat in them. Other good options would include dairy products that are full fat, and that can be a better choice for someone who's struggling to keep their weight up. So many of us are used to choosing fat-free milk or low-fat milk, low-fat yogurt. And if you need the extra calories, it's actually better to do the full-fat dairy products. Now, having said that, if someone's really struggling with appetite and eating, there's no wrong in terms of fats as long as they're tolerating it okay. So they can feel free to use more butter or to even sometimes indulge in a food that has been fried, as long as it's not making any symptoms worse, such as diarrhea.
Thank you. Our next question is, do you have any suggestions regarding taking calcium supplements for osteopenia, timing of supplement, taking it with food, etc.
Sure. So, honestly, when it comes to a supplement like that, my best advice would be taking it at the time of the day where you are most likely to remember and be consistent. So, for that supplement in particular, I likely wouldn't worry too much about whether or not it's with food, just timing it based on when you know you'll remember to take it. So, personally, for me, I'm better about taking my supplements if I pack my supplement container with my lunch every day. And then when I pull out my lunch at work, the supplements are there. So that's how I tend to take it.
Thank you. This question is, what is the current wisdom regarding a neutropenic diet? Lately, I've learned that even rice is considered risky.
Okay. That is a good question. So I I think the trouble with me answering that is that with a neutropenic diet, what we see is that every cancer center practices that a little bit differently. So I would say overall, we tend to all consider severe neutropenia as an ANC, absolute neutrophil count, of less than 500. And when someone is severely neutropenic, we there is some good consensus that they should follow a neutropenic diet until their count recovers. So that truly would be staying away from most raw fruits and vegetables, unless it's something like an orange or a banana where you can wash it and there's a thick peel protecting it. That would definitely be no raw or undercooked meats. All of the animal protein should be cooked thoroughly. Everything should be pasteurized. However, outside of that, most cancer centers have really liberalized and they focus on a food safety diet. So, again, the only exception tends to be for an ANC less than 500. So, I'm not aware of any cancer centers recommending patients avoid rice. Of course, it should be cooked. I believe the concern is leftover rice, leftovers in general. Even if we're storing them properly in the refrigerator, there is a risk of bacteria growth. So I think for rice, you do want to limit it to just a 1 or 2 day supply and not eating rice that's been in the fridge much longer than that.
Thank you. And speaking of leftovers, what is the time frame of leftovers? How long are they okay to keep in the refrigerator? What is the safety for that?
Sure. So I believe for the average person, we're really encouraging 3 days or less. Um, Everything can be safer if you say, for example, I like to meal prep over the weekend and make large batches of food, but I wouldn't necessarily keep all of that in the refrigerator to get me through the week. So you can always, if it's an item that can freeze okay, put smaller portions in the freezer and then just pull out a few days worth at a time. But I would say for the most part, we're probably looking at 3 days or less. For severe neutropenia, we may be erring on a shorter side of that.
Thank you very much for that. Our next question is, are there any foods that can stimulate bone marrow to produce more red cells and more platelets?
Oh, sure. So that's a question I get all the time. I think at this point in time, we just don't have a whole lot of research to show that there are specific foods that can really help boost the bone marrow recovery. So I always have patients focus on the basics, making sure that you are taking in enough calories and protein. That truly is the foundation for any cell recovery in our body, including bone marrow. So taking in good calories to keep your weight up, and then making sure your diet is rich in high protein foods. So some examples of that would be consuming protein shakes, using protein powder, snacking on protein bars. Our animal products give us a lot of protein, often in a small serving size. So consuming beef, pork, chicken and turkey, fish and seafood. Eggs give us good protein. Dairy products from a cow have a lot of protein, such as Greek yogurt, milk, cottage cheese. And we can also get protein from soy, tofu, tempeh, from any bean or legume, and from nuts and nut butters. So those are just some examples of high protein foods. And I think it never hurts to have variety in our diet just to ensure we're getting lots of different vitamins and minerals. I hope that we'll find that that helps to support the bone marrow recovery. But I think in terms of specific foods, the research just isn't there yet at this time.
Thank you so much for that. Our next question is regarding heartburn. Are there any foods that can aid or even prevent heartburn? And what foods should people avoid that can cause heartburn?
Sure. So heartburn can be a little bit more of an individualized symptom. Some patients have heartburn and they really insist that there's no rhyme or reason to it, no foods that necessarily trigger it. However, some patients tell me that they have identified some triggers, and often it is anything very spicy or heavily seasoned. For some patients, it's anything very high in fat or greasy that tends to stay in our stomach longer because it's harder to digest, and then we're more likely to have that acid reflux. Usually, one of the main triggers is actually eating shortly before lying down, whether it's to take a nap or to go to bed for the night. So when we do that, if there's still food in our stomach that's being digested and then we're lying down, there's less gravity. Gravity's not able to work at keeping the reflux, the acid in the stomach, and it starts to kind of creep up into our esophagus. So making sure you stop eating if you can about 2 hours before bedtime, or if you need to rest, if you have the ability to use a wedge pillow or to rest in a recliner, that can be helpful. Big portions can increase the likelihood of reflux just because, again, it's more food that's kind of stuck in your stomach for a longer period of time. So small, frequent meals could be helpful. Sometimes caffeine can make reflux worse. So caffeine loosens the sphincter, the flap that keeps reflux and acid in the stomach. So being careful with caffeinated beverages like coffee or caffeinated teas. Sometimes chocolate exacerbates reflux because of the caffeine. And some patients feel that mints like peppermint or peppermint tea also make their reflux worse. And we believe, similar to caffeine, that it loosens that, it relaxes that flap that keeps the acid in the stomach. I don't know that we have a ton of foods that can really neutralize that acid. Some patients might sip on alkaline water in between their meals just to neutralize that acid, and there's not too much harm in doing that. But otherwise, it might be short-term sticking with bland foods. Softer foods might be digested a little bit more efficiently. Again, not eating too close to bedtime and smaller, more frequent meals. That may be the most helpful.
Thank you very much for that. Our next question is regarding iron. This patient has to be very careful about iron as they're having blood transfusions. What food should someone avoid that may be high in iron when iron overload may be a concern? And is eating red meat in that category to avoid?
Sure. So that's another great question. So with the repeated transfusions, there is that higher risk of iron overload. So The iron is more readily available in animal proteins, especially meats. So that would be beef, pork, chicken, and turkey. And the iron in those foods does tend to be more easily absorbed by our body compared to plant irons. So I don't believe that most places would recommend patients completely avoid animal proteins, but they would usually say making sure the portion size is controlled to maybe about a quarter of your meal, and then maybe balancing out some of those animal meals with some vegetarian protein meals. Now, one of the things that you could do is be careful with vitamin C intake, which actually improves our absorption of iron. So, if you are eating any of the high iron foods like a steak, maybe separate it from vitamin C, eat your broccoli separately. Now, on the other end of the spectrum, coffee and tea can inhibit the absorption of iron. So you could think about including coffee and tea with any of your high iron meals.
Thank you. Is there value in adding spinach to soups and stews for a patient with leukemia?
Sure. So I think there is value. It's a good source of fiber and minerals and vitamins as long as the patient enjoys it incorporated into those recipes. So I very much think that we should find ways to increase fruits and vegetables, but it also should taste good and it should be enjoyable. So if someone, I find spinach, especially in smoothies or soups, a little bit goes a long way. In soups in particular, it will cook down and it doesn't change the flavor too much. If any of you were at any of my presentations in the past, you know that I've made smoothies at some of the conferences that included spinach, and everyone always thought it tasted okay as long as we included a sweet, strong fruit. So as long as the individual likes the taste, if they don't like the taste, then there's other ways to incorporate fruits or vegetables. So an example would be if someone did not like the taste of spinach in their smoothie, or they did not like how it changed the color, we could instead, what I commonly use is frozen cauliflower rice, and I will use that in a smoothie. And frozen cauliflower rice will just add some creaminess to the smoothie, but it does not change the taste and it doesn't change the color. So little substitutions might be a little bit better tolerated.
Thank you. And the smoothies were delicious. It didn't even taste like it had spinach in it.
Yeah.
So our next question comes from a patient that has some lung comorbidities and their body burns through calories extensively. They'd like to know what are some slow digesting protein products that could be consumed prior to bedtime, similar to casein, that could provide calories and proteins through the night and not exacerbate GERD or lactose intolerance.
Mhm. Great question. So, very often we see with lung disorders that calorie needs are very high. Our lungs have to work so hard that they're really burning through a lot of fuel. So, very often those patients do need to take in more nutrition just to maintain their weight. So, I would definitely make sure that you're perhaps in your meals and in your snacks, finding ways to maximize the calories and the protein, like using more olive oil or adding some of the avocado or more cheese to your dishes. And then in regards to, so then we would also suggest the small frequent meals, so snacking in between each of your meals. But then in terms of some high protein snacks in the evening, so I think it could be half of a protein shake or even a full protein shake. Liquids tend to empty from our stomach faster than solid food. So as long as you drank a protein shake at least an hour before bedtime, you might be okay with that. Or again, if a full protein shake is too much, you could do half of one. I think it could be a couple hard-boiled eggs with some crackers or a banana with peanut butter. I think it could even be Greek yogurt or yogurt, and you could add some fruit or do a flavored yogurt, or cottage cheese as well. That's another great high protein choice, and that should work easily with lactose intolerance. But the protein shakes, such as a Booster and Ensure or the Orgain, might be the quickest and easiest option.
Thank you. This question is in regards to IV vitamin C supplementation. Can you provide any comment on the effectiveness in helping leukemia patients?
Sure. So I will admit I'm not certain if there is any particular research on vitamin C with leukemia. I know that in my experience with patients who receive IV vitamin C, they do tend to feel like they have a little bit more energy. So it does seem to be helpful with that. But to the best of my knowledge, when it comes to vitamin C and some of the disease sites I work with a little bit more closely, I'm thinking of like lung cancer and pancreatic cancer. I don't think at this time we actually have any research to show that there's added benefit to that, which is unfortunate because if it did seem to make treatment work better or if it did improve survival, I'm sure that this is something that many of our cancer centers would want to use, but I don't think the research is quite there yet. So just make sure if you are receiving IV vitamin C, especially if it's from an outside provider, just make sure you're communicating with your care team so they can make sure there are no overt contraindications to that.
Thank you. Patients with bone marrow failure diseases need to be very careful with food. Could you speak to food safety, making sure for safe food prep and being mindful of any foodborne illnesses?
Sure. So I do feel very bad for this population because I know that food safety is a little more important, but it's also something that tends to be very long term. Whereas with some of our cancer patients, usually that neutropenia is a little bit more short term, and then they get a break from all the worry about food safety. But I do know for this population, it lasts longer and it can be very tough. So with the bone marrow failure or from the treatment itself, our immune system is very compromised, which means we are far more susceptible to get sick from the things that we eat and drink. So making sure that in the home you are washing your hands before you start to touch food or prepare your meals, but also in between touching anything like a raw meat and then going to work on fruits or vegetables, make sure you're washing your hands again to get rid of any bacteria. Making sure that you have separate cutting boards for your animal proteins that, for example, like the raw chicken that you're cutting versus separate cutting boards that you are using for fruits and vegetables and things that you don't cook. Making sure that any of your animal proteins are cooked all the way through. Technically, that even includes like eggs should be a hard egg versus an over easy runny yolk. Of course, being more mindful eating outside of the home, especially when it comes to something like a fruit cup or a salad, where we don't necessarily know if the person who prepared that washed the outside of the fruit before cutting into it. And then when you are at home and you're preparing any fruits or vegetables, making sure you are rinsing them with cool running water before you prepare it. So even something like a watermelon, you want to rinse the outside before you cut it because any bacteria, when you cut through with the knife, you're going to drag that through. If you are severely neutropenic, focusing on canned fruits, frozen vegetables, frozen fruits for smoothies, and being mindful of the raw that your team may have encouraged you to hold off on for a period of time. But I would mostly say just lots of hand washing, being careful with the leftovers as we discussed, really wiping down your countertops, likely with a product that includes some bleach just to kill any bacteria. But honestly, hand washing is probably the most important.
Thank you. And I think you answered this, but just in case you want to add, that this question is, can you recommend sources of protein in addition to the ones that are obvious, such as meat and dairy?
Sure. So, um, again, the meats and the animal proteins do give us kind of the biggest bang for our buck. So, beef, pork, chicken, turkey, fish, and seafood. Eggs are a great protein source. Dairy products really do have a high amount of protein. So, Greek yogurt, for example, gives you twice as much protein as a regular yogurt. And Greek yogurt is quite comparable with like a piece of chicken breast, for example. Cottage cheese, ricotta cheese, milk will give you some protein. So when it comes to some of the more of the plant-based protein sources, we are thinking of tofu and soy products like soy milk, edamame, which is the soybean, and tempeh, which is a soy product. Any sort of bean will give us a lot of protein. So that could be something like hummus or making a three bean chili or having roasted chickpeas on a salad. Our nuts and nut butters like peanut butter, almond butter, a handful of pistachios will give us some protein. And those are sort of the main foods. Plenty of other foods will give you 1 or 2 grams of protein here or there, including whole grains. But it just gets harder to kind of meet our needs if we focus on that. So if you really do struggle with taking in enough protein, it may be beneficial to add in protein powders or protein bars. And that just can give you a very quick, like 20 to 30 grams of protein that you could make in a smoothie, or some patients add it into their regular foods, like a little bit of protein powder in an oatmeal dish.
Thank you. Our next question is there value in collagen protein from Jello products comparing to say whey
Right.
or animal protein with more complete amino acid profile when it comes to wasting?
Sure. So in that in the case of our patients going through treatment who really need a high quality, complete protein source, I generally do not recommend collagen protein powder because that's really not going to help us build back lean body mass or strength. The exceptions would be patients who, for example, have lost hair or nails or have some skin damage from their treatment. Then adding a little bit of collagen can help to support recovery of that. But for the average patient who wants to maintain their strength, get stronger, and ensure they're meeting their protein needs, we do want to focus on the whey proteins or any of the plant proteins like the rice or the pea protein, or our food protein sources. But the collagen, I really do think of it as mostly being for hair, skin, and nails, but not really for building back our muscle mass or our strength. But that's a great question. I know collagen protein powders are very popular these days.
Thank you. And what are your thoughts about bone broth for patients? Is that a good source versus, a regular chicken noodle soup?
Sure. So bone broth will give you a little bit more protein and a little bit more minerals just because of the cooking method that really does involve the bones of the animal the broth was made from and the long, slow cooking method. So there is just a smidge more nutrition. If you are someone who enjoys spending time in the kitchen and you don't mind having something on the stove all day, or if you have an instant pot, that can be a good way to make homemade bone broth. But if that's not really working for you, then it is perfectly okay to use the regular broth that you buy in a container. Again, there's just a little bit of a difference with protein and minerals, but it's perfectly fine to use either. You can buy packages of bone broth these days. Sometimes it's shelf stable in a carton or in a jar, and sometimes it might be in the refrigerator or the freezer section. It does cost more than regular broth, but that is always an option for someone who just wants to use the bone broth. Some of the thought is that it might help to heal the GI tract, just with some of the different nutrients in it, almost similar to the glutamine, where we know that that's that really good amino acid for healing all the cells of our GI tract. So if you would like to use bone broth, I think it's a good way to get some extra nutrients. But if you just need something quick and easy and cheap, then you can certainly use regular broth.
Well, thank you so much, Joanna, for sharing your time and your expertise with all of us and answering all these wonderful questions from our participants today. If you'd like to watch this webinar again at a later time, it will be on our website within just a few business days. If you have any additional questions, you could send it to us at any time in 3 ways. Send an email to help@aamds.org. Call our helpline at 800-747-2820, or submit your question to our Facebook page. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us today and making us your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 39 years. This concludes our program. Thanks again, Joanna.
Thank you for having me.
Take care now. Bye-bye.